All right, everyone. Thank you for joining us on this Saturday morning. I am Dr. Shanice Armstrong, the current treasurer for the Arkansas Counseling Association. We're so delighted to have you guys attend this wonderful presentation on tending to existential needs of clients during COVID-19 with Dr. Monica Band. Dr. Band is a recently awarded ACA. Let me make sure I get her correct title. Dr. Ben, what was that award that you were just given by the
Oh.
American Counseling Association?
um, yeah, I was the Robert Rankin Emerging Leaders Award. Yeah.
Just
Thank you.
calling her out a little
I know
bit.
that was a little, yeah.
So we're very delighted to have her speak with us this morning. She's a former president of several council associations and the Southern region. So it's very pleasure to have her this morning. Once again, we want to thank you all for attending this morning. We and the Arkansas Council Association are delighted and humbled to provide quality webinars and presentations and training and development for counselors, counselor educators, and school counselors. And so it is a delight to have you all with us this morning. And with that, I'm going to turn the floor back to Dr. Band.
Thank you guys so much for spending some time, especially during your precious weekend and morning, to be with me, to be with all of us. Also, thank you, before I forget, because I'll just go into talking about counseling skills and existential therapy. I do want to extend my gratitude to the Arkansas Counseling Association for this wonderful opportunity to share. This presentation will be approximately an hour with some time for questions, which of course you can put in the chat if anything emerges, and I'll also provide some time towards the end. And as you can imagine, within an hour or a clinical hour, there's a lot that we can cover. And so what I'm hoping in this presentation is that for those of you who aren't new to existential therapy, or even just the tenets or philosophy of existential therapy, that you begin to maybe find a budding interest or plant some seeds for things that you can do, say, and are aligned with. And I also would hope and encourage you to, be curious about some of this material that we'll be talking about. It might even provide some validation too for some of the techniques if you're already using with clients, and maybe just how to weave in or enhance the process even more. So one of these things that I find interesting, but also sometimes challenging with webinars, is that I don't necessarily know who all the audience comprises of. So in the past, I know there are some people who are practicing clinicians, while there are educators and students and residents. And so we might have a mixture of folks from different perspectives. So please share your voices and questions as we go through. And if there's something that I'm missing, of course, I'm open to hearing how you all, should you practice in the same way, or what, if you're seeing clients right now throughout COVID, what you're seeing as well. So maybe we can share some of that. The other thing that I'll say is it's probably helpful to understand who you're listening to. Thank you, Dr. Armstrong, for the introduction. Just a little bit more about me to kind of shine light on my positionality and where I'm coming from as I provide this presentation. I spent 3 years or so being a counselor educator full-time at a university in Virginia. And since I was seeing clients part-time, and then since shifted my focus in seeing clients full-time at my private practice. I'm licensed in Virginia and Washington, D.C., and I have a practice in Washington, D.C., although, as many folks have transitioned to telehealth services full-time to accommodate clients' needs. I am, in addition to being licensed in both those places, I am EMDR certified, and so I do come from a trauma-informed perspective and interweave a lot of EMDR framework within my work. So you'll see that a little later on in some of the questions that I will pose and kind of prompts that I'm going to provide to you to share with clients. I'm Gottman method trained as well. I see individuals as well as couples. And in addition to that, I'm a certified career counselor and a rehab counselor. There are a lot more to that, but I think if you had to take anything away from my approach or style, you'll notice that there's an interweave of existential humanism along with trauma-informed practice. And then finally, there's a cultural component to a lot of what I do. I'm Chinese American, and I often see a lot of API, immigrant, refugee status clients as well. So that's probably a little more about me than we may need to know, but that'll paint the picture or set the tone for where some of the perspectives of where I'm coming from. The last thing I'll say before we move into today is that I really, through my educational career, like to provide a practical emphasis on what we do. So this will be less about telling you or lecturing you on existential philosophy and existential theory, although fascinating as well. And this is more about the practicality of how to apply some of those philosophies and some of those tenets, if you will, on a day-to-day. So what does it look like when you are working with clients? What do you say? I always found that more fascinating. How do the theories apply to the work that we do as counselors? So without further ado, I'll begin, and let's see if I can make sense of how to click through this. All right. Let me minimize my chat here. So just to set the tone, again, for those of you who are new to existentialism, I just provided two very simplistic bullet points to help you kind of ground yourself in the theory. I find that this approach and this philosophy align very well with global, similar to COVID, global crises that we are all universally experiencing certain themes or threats, as Yalom would say, for those of you who are familiar. And so I want to highlight a few things here because it'll help set the framework for what we're going to be talking about. So individuals are self-determining, which is a wonderful way of saying, and very aligned with therapy, which is that we are trying to empower and encourage autonomy, agency, as said, and then also efficacy, so that clients can make meaningful and authentic choices. They are sort of the drivers in the meaning-making process, and therapy is a wonderful way to do that in a very natural and organic way because you're co-constructing meaning with your client. So it's a very relational and hopeful message, and yet it's born out of this assumption that otherwise, should we not do this, life can be pretty erratic, chaotic, purposeless, or meaningless, depending on what philosophers you read and how that looks. It can be very bleak. So once we accept that to be true, that there is purposelessness, meaninglessness in our lives, we can begin to become free of some of these fears. And so the first bullet point you'll see is a very simplistic sentence describing a major aspect of existentialism. And then secondly, you'll see how it's applied to mental health. Again, kind of Yalom being one of the more notable psychologists who have used a lot of group work and own casework in order to perpetuate some of this message. And so you'll see as I read through these and as you also read along that these are closely in line with what we see happening with clients during COVID. So there are basic human issues that all people struggle with, according to Yalom and existential humanism, and that is isolation, meaninglessness, morality, and freedom. Those of you who either do this work already or are about to see clients, you could probably imagine where all of these things are beginning to line up. And I'll give you a few examples too as we move forward. Okay. So let me just move this a little bit. Okay. Let's look at how these four givens, as Yalom would call it, or these existential threats, as you'll see in other literature, show up during COVID. And this is, of course, not an exhaustive list, but you can begin to see how a lot of these four drivers can impact your work. You may already be seeing them and working with them. So very quickly, you can see fear of death. Well, there's a collective grief process, a collective trauma process occurring throughout the world, as well as a re-traumatization. And this is where I don't know about you all, maybe we can hear if we have time towards the end where you are seeing this, but there's a lot going on, not just in the world and other folks' communities, but there are constant reminders sort of knocking at the door of trauma for our clients, individual clients, and there is often a re-trauma process. So I don't know about you, but in speaking for my own work, I often, we'll get into this a little later about the skill set of what to do when we see this, but oftentimes there's a reoccurrence, perpetuation of trauma and particular oppressive systems that a client is experiencing a lot of anxiety and distress about, and I'll explain that more a little bit later. You can see here that there's a constant reminder of death, whether it's, I don't know, if earlier on how you all digested your news, whether it's through social media or otherwise, but there are graphs and charts to show how people are, it's very dehumanizing actually if you think about it, but sort of the rates in which people are being infected and the number or death count, if you will, of people. So you see that earlier on, people ingesting sort of information because of the uncertainty. People are looking for a sense of control. And then an acknowledgement too, even now ongoing into the months in which we are sitting here all together, that there's an acknowledgement that time is relative. Which of course, some clients, at least the ones I work with, characterize this as COVID times versus other times, which is interesting. So it's creating sort of its own vernacular around sort of what people are experiencing. There's a lot more, of course, in that point alone, but I want to be respectful of everyone's time, and we'll get to some other points here. So the drive towards freedom, this is an interesting one. Freedom in the physical sense and restriction during quarantine. Sort of despair and unrest with injustice and polarizing political climates, and then, of course, anxieties about when will things get better. So again, kind of going back to that time, but taking on a different note. So you might have already come across, even personally or with other clients, the meaninglessness that people might be deriving, like, you know, sort of quote unquote, what's the point? And I don't know if I can plan for the future. I have all these plans for the future. For some people, that creates a nice grounding point and, you know, forces people to be more mindful and in the moment. For other people, it makes them really uncomfortable to not have anything to look forward to. So the next point here as we move forward, like Yalom would say, that we're moving towards avoiding any sort of isolation, because isolation is, of course, a reminder that we don't have freedom, and it also riles up that fear of death. And so you can see too, isolation as technology has helped us communicate and connect, as now I think most of us would agree that there's two sides to that coin, and a lot of people can get kind of stuck into a filtered sort of loop or cycle in which they might compare themselves to other people, what other people are doing. And technology does not always perpetuate connectedness. It can instead do quite the opposite. This kind of goes back, this next point in isolation kind of goes back to polarizing views and news about the world, but it can create a lot of distrust. And then finally, we're seeing sort of later on in COVID and how it sort of evolved in disruption, that there's some boredom attached to that. So I try to encourage my clients to get to know and check in with their relationships with themselves. For example, when they're sitting in that stillness, and what kind of associations do people have with boredom when maybe they've been disconnecting from themselves anyway through work and school and otherwise. And then finally, now meaning, right? So I mentioned this earlier, but now we're seeing these larger questions. Who am I without these relationships? distractions, even rituals and routine, commute to work, and identities that I'm now questioning. If I don't have these things, who am I? So these larger questions are coming out. But of course, we can't get to any of these larger questions without focusing in on sort of the disruption of this all in the first place. So I wanted to take a moment, I think, before we get into the skills piece or the what to do, the practical piece I was alluding to. And I think this will not be a surprise for many of us, but we've had to, those who haven't seen clients completely or sort of in hybrid with technology, there's certainly some getting used to. I did most of my work speaking personally all in person, and as well as my EMDR sessions, and this was really interesting to transition and help clients who were not used to this either. So some of this is setting the tone and normalizing the fact that this is unusual, especially for those who first saw you in person. And I wanted to make this point because I think I'd love to hear, if we have time, to get to know sort of your experiences as well. But I think there is a difference in when you first see clients in person and then had to move virtually versus clients you onboarded and saw via intake virtually first. There are some attentional issues. Where do you look? You know, and then also physical ones in which we have to address as well. These things I think are worth being transparent about. And I think in the past, if you were to see a client in person, for example, someone who maintains eye contact and someone who you know, seems very attuned to what you're talking about in person, but then begins to get distracted or hears noises outside. We try not to pathologize those things, I think we all know, but that can take some getting used to normalize that. Planning, I don't know if many of you experience this as well. I'm sure by now, a couple months in, have with different options to connect and addressing any kind of technology issues. Ethical considerations for ourselves. I'm going through this briefly to get back to sort of our how-tos later on in the slides, but it's worth mentioning, of course, and always, that there are some ethical considerations when it comes to providing telehealth, of course. And this one, I think I've come to appreciate even more for those of you who've also had clients who may have been stuck in certain places or maybe decided on their own accord to stay at home or to visit people and then quarantine, that maybe you were at one point providing services across state lines, and the federal government or that state for a couple months, you know, allowed that to happen because of the crisis. And that happened in the first couple months. And so I'm sure many of other people were kind of abreast to sort of the local laws that were being put forth for our consideration. I think they overall, I think, did a great job. And maybe as a quick aside, wouldn't that be great to have a catalyst towards how important portability is for us, right? That being said, as we think about things that we can process. So if you're seeing a supervisor, if I have residents in here, students that are attending this right now, or even you know, clinicians, as we kind of lean on our colleagues to consider that there are boundaries too that I don't know about you all, but for me was really a stark contrast. I live in a small place in DC, kind of city living, and there are very few options in which I can see clients in, and to invite them, get used to inviting them in my personal space was getting used to. As well as other distractions. I have a dog, some other people and clients have pets and children and spouses or roommates, and, you know, sort of the ways to check in with each other about if this is a safe environment and what to expect. Now I kind of add sort of my dog will disrupt my therapy sessions, which we'll get in a little later, but if we have time. But, you know, these are things that I hadn't considered at first and didn't have control over. So from a clinician standpoint, you know, we've had to deal with our own sort of adjustments as well. And then finally, I just wanted to own that my own position on this. I'm not seeing children right now. So those of you maybe working in schools who are attending this or seeing children or families. So a lot of what I'm sharing right now will come from seeing adults and processing meaning with adults, although in talking to folks who do see children via telehealth, I've heard all sorts of things about having to adjust as well, whether it's shorter time, attention issues. A few art therapists I know also have to get creative, more creative than usual, I guess, with the lack of materials that they have at their disposal. And so all of these things I won't be getting into today as we talk about existentialism, but I'm sure that there are ways to do this with children in more creative ways that I won't be getting into. So I just wanted to make that known as well. All right. So this is what I'm talking about when I want to bring a practicality to some of these things. While I want to interweave existentialism, there are some things that I think that are just worth integrating before we can even get to existentialism, because here we're talking about sort of higher order or meta thinking, cognition, if you will, and processing these bigger questions of who am I? But you and I both know that we can't get to those places until we begin to regulate and moderate our physical and emotional space. So if you don't already do this or some form of this, it's worth noting as well. And I gave you a couple examples here. So some grounding before you begin. So before we get into today's work, for example, how are you showing up today? What are you noticing in your body or in this moment? How are you feeling right now? Interweaving, depending on your perspective or your comfortability, guided breath, grounding tactily, and then also visually. And so again, some of these things you may have already integrated, but I know for myself during COVID and having to do this via telehealth, I've had to be even more intentional and assertive, if you will, about checking in over and over again, because I don't have all of my clients' visual space. I'm not sharing that space with them, and so in person, and so in seeing only maybe their shoulders to the tip of their head can be limiting for the type of work that I personally do. So I find doing this is really great. And as an aside, I have also found having to check in even more so than I would normally and prompt that, because I don't have that extra extension of seeing them in person. I want to focus in on one thing I want to highlight. You'll see a lot of sort of EMDR, trauma focused or framework weaved throughout some of my questionings or examples of things you can say. So one of those, for those who aren't familiar with that or haven't taken the training yet, would consider maybe creating a safe and calm place for the client. This is a way of doing a guided visual. And that's very quickly, there's a lot of mechanics to this, but very quickly, it's exactly how it sounds. And I hope if they don't have a physical space to do that in their place of living, that they're able to find a place visually for themselves to close their eyes or keep them open if they feel safer doing that, and being able to focus on an image, or if we can, encourage any type of sensory information, touch, smell, sight, taste, even in some cases, how that feels for them to get back to if they're not in that type of space. And I don't know about all of you, but I have been in closets and bathrooms and parks and all sorts of cars, all sorts of places with clients. So it's definitely interesting times. So then moving into your typical opener. So after you've done a grounding, to begin in a summary of previous session, if that's applicable, but also since we last met, let's do some updates. Or I like to do this more often too, especially getting back to that Yalom tenet of freedom, encouraging autonomy. So how would you best like to use our time for the day, which is it's more open-ended. So if you're on sort of this solution-focused or CBT or certain route that you're kind of following and monitoring, this may be too open of a question for you. But then again, it may be a nice switch or change. So that's why I want to provide a few options there. Okay. So after we do grounding, we're building up to being able to have existential dialogue, because again, it's worth reiterating, we can't do that yet until we make sure that our clients are in this space to be able to have these conversations. So we're interweaving monitoring any type of disruptions. I'm sure many of you asked a type of question like this when you first saw your clients. How has COVID disrupted your life? That's a great general opener for clients, but since we're a couple months in, we might even say, how has COVID changed or transformed and sort of disruption, and it's taken on sort of this own, you do narrative therapy, it's sort of its own sort of external thing, if you will. So you get really creative with writing. We'll get into some of those things a little later, but that's fun too if you're a narrative therapist and like to use some of those more creative pursuits to channel in some of our feelings towards COVID as its own entity, if you will. So again, I think many of us have already seen the value in doing this. I know I go back to my own rehab counseling days where this is first and foremost important. How did you sleep last night? So we're checking in. Sleep hygiene, for example. I won't read these things verbatim, but you can see how these things will be important to set the tone, and how monitoring them will be important. So that's the other thing. You may have seen those articles in which more people are experiencing vivid dreams, and what that might mean for them now that they don't have work or they're working from home. Boundaries may be blurred. Of course, exercise with quarantine has been, and moving around and stretching has been sort of limited in some spaces or places, depending on where you are in the world, right? And then eating habits as well. I do work with folks who are diagnosed with body dysmorphia, OCD, eating disorders, OCD surrounding food. And so these things you might want to monitor even more so. And then this, for those of you who are more behavioral minded, thinking of replacing old habits with new ones, because the ones that used to work pre-COVID are not anymore. I'm sure you've seen that. Okay, so just a few more examples as we kind of get into it. I want to be sort of mindful of time as I'm moving fast. So the next one is to be thinking of other aspects holistically of someone's life. And these might be different depending on the client you're working with, their presenting issues and their diagnoses. Perhaps you spend more time on one than the other. Or one realm, if you will, of that holistic wellness wheel, as we all know, than another. So how are you noticing others react to you differently? How are you reacting to others differently? This is a nice interpersonal gauge. I like to ask this question because there are some folks who maybe are more intellectual and rational, have a hard time, especially during those overwhelming or anxious moments, to see outside of themselves. And so it's coming from a very ego space because they are distressed. It's really hard to kind of step outside and observe. And so this kind of common sense, as we know, isn't common when we're in a crisis, because our body is physically reacting to it, and our prefrontal cortex is sort of shut off for any sort of organizing our thoughts. And so this is a nice one to kind of step outside yourself and observe. How have your relationships been different? Very, very broad question, of course, but you can narrow it down and specialize it to partners, roommates, ongoing issues with roommates. Of course, intimacy, sex, affection. How has this changed? A lot of people who live alone or who were dating, you might be working with people who are having a hard time with that isolation piece, as we've mentioned before, in Yalom's tenets there, the four givens, if you will. So you can see how each of these, while we're monitoring sort of these behavioral changes and how they're manifesting, they are speaking to these four givens. You can kind of put them into those categories, if you will. And then, of course, we might have been doing this for ourselves. I know I've had to create hard boundaries around technology and news, and as my early 20-something clients have now informed me, it's called doom scrolling. So I don't know, I feel a little out of touch there, but how then are we reacting to some of this information, and can we do something differently with it? And how much is it really helping us or causing us distress? So you might have even at the first time COVID, first 2 months or so this was happening, people were just ingesting all of this news for a sense of control, as I mentioned at the top of our time together. And now we're seeing people sort of create healthier relationship boundaries with ingesting this. And then others, I have lots of clients who were either furloughed or lost their job. I had clients in the service industry and entertainment industry that were certainly impacted. Those folks who have kids and young ones at home, as well as students going back to college. Safety planning, if applicable, as well as symptomology. For those of you who work with folks with OCD, I also saw an increase in obsessive and compulsive behaviors, mostly centering around cleanliness and needing to normalize how much of this is coming from the additional measures one needs to take to prepare to be safe for those and those around him during COVID, and how much of this is getting kind of characterized in some of the symptomology a client already has and struggles with, and the shame in that, right? So there's a lot of shame and those hard shoulds of this is how I should be, and this is what I should be doing during this time, and I'm not. Speaking of shoulds, maybe some of you have already come across this as well, a lot of shoulds surrounding productivity. We don't have work exactly, or work boundaries are different, or people are trying to be more lax and understanding what's left over, how clients have internalized those shoulds, and how much distress they're causing because they're so rigid for our clients. So some of it, for those of you who are more person-centered or do DBT, you might be focusing on you might be emotionally focused therapy. You might be focusing on self-compassion and positive psychology, interweaving with that. Medication changes. I've been working more and more with psychiatrists because clients who are already on medication, who are thinking of taking medication. So these are just, as I mentioned at the top of our time, the purpose of this is to just plant seeds in some ways. But if you haven't already checked in, and maybe there's a nice note to do this and round out sort of some of our talk. So let's get into sort of co-constructing meaning. So once grounding is completed, updates from previous sessions, maybe in a summary, we want to address clients' perceptions, attitudes, and beliefs of some of these tenets that we've talked about, that we keep referring back to. Isolation, right? What are our thoughts, feelings, associations with being alone? I've often had clients sort of shift sort of this idea of loneliness and being alone with stillness and quiet and calm, and how they are very different on the spectrum, and playing with those themes. Also, it's helpful, those of you who are more psychodynamic minded or who just like to focus a little bit more on past history to gather information, may want to talk through early recognition and value placed on being alone. What was it like? What are some early memories of being alone or experiencing death? I find this helpful. I pivot often just personally between gathering past information, but shifting the focus to how it shows up and manifests in present symptomology or distress versus staying completely in the past. But other folks like to spend more time there than I think I would. But really worth noting when you're talking about existentialism, because a lot of these things were formed more so during our formative years, these attitudes and beliefs. And then acknowledging the client's relationships with uncertainty. We all personally maybe have a physical and emotional reaction to things we can't control, the future, the things we can't see. And we often view them as a threat. And so we picked that up from somewhere, as I like to say to my clients, where did you pick that up from? And sometimes clients have, distinct memories in which they can relay back to uncertainty in general, the unknown, if you will, just being something that was very scary. For those clients, or for those those in the audience right now who are listening who work with trauma, you've probably come across sort of this re-trauma process where once someone experiences calm in their physical sensations of calm and their body begins to decompress, those who are reacting from past trauma actually have sort of this I'm waiting for the other shoe to drop sort of mentality, in which they can't fully sort of just let go and sink into that feeling because it's often associated with fear, right? It's associated perhaps past experiences of inconsistency, and there can be a lot in that. So those folks who have past traumas, both big T and little t traumas, as they get activated during this COVID time, you'll notice how a lot of these themes begin to spike up, thoughts of death, isolation, and being alone. For someone who had to hide, for example, both physically or emotionally in their family system or during their formative years because it wasn't safe psychologically or physically, now you have an entire sort of global pandemic bringing these feelings and thoughts back up, perhaps. And so these are things that we talk about. So that's anxiety on one end. And so I often like to unpack sort of where physically, first and foremost, anxiety manifests in the client. And it's different for everyone. Most people end up, if we know about the autonomic nervous system, most people experience that gut reaction, but not always. Some people experience tightness of chest first, or acknowledge the closing of the throat, which is interesting too. And so it's good to pinpoint some of these physical spaces for our clients, because as we've talked about at the top of our time, you're going to want to go back and do some breath work throughout your session and focus in on that exhale as it calms down your heart rate, right? So the exhale that we want to pay attention to thoughtfully. That being said, there's also a shifting away the focus from physical distress. There's also guilt that you all may have come across in certain ways. Maybe some people in their privileges are doing more well off than others and have this chance to reconnect with people while others are not doing as well. And there can be, I don't know if anyone's come across this either, as I kind of talk to you all, but I've seen and come across a type of survivor's guilt too, especially in employment spaces. If I do career counseling, there's an essence of I'm doing well, but I see and hear other people either that I directly work with or in my social circles who are not. And while I'm grateful, I also feel terrible for these people that are also experiencing this in a very different way than I am. I also see this and saw this a lot with the spike in xenophobia towards the AAPI community during the Black Lives Matter movement, being in DC. If I have anyone else around this area or who experienced some protests, there are clients who sort of held the tension of wanting to be involved and be an advocate or go out there and protest, for example, but feeling constrained to do so, and a lot of guilt, which we know is internalized shame. All those shoulds get sort of manifested, internalized, and then the boundaries between them get really blurred. So you can do a lot for those cognitive folks who deal with a lot of shoulds and rigid thought processes. That's the first way, or the door to open to get into that guilt. And then going back into the body. So there's components here that I try to set up for my clients. And if you haven't already done this yourself, I would encourage you to help them look at this from what I like to say a more dimensional approach as they experience these things. Because more often than not, your clients are going to have strengths in one over the other. Some people are more emotionally focused naturally, and you're working with them from the beginning about how to regulate that. Other people may be more cognitive. So a lot of those folks who in graduate school and who are work with a lot of lawyers, people who often rely on those strengths, have a hard time focusing back in on their body or even just labeling their emotions. I've given out so many feelings wheels now, I can't even count during this time. But that is a way our body begins to protect itself. And so we might even just find ourselves relying on sort of where our natural inclinations end up going. And then finally, physical, right? So some people may be really in tune to that the shifts in their body, but can't articulate what's going on either. Hence the feeling wheel, or being able to label those things in the moment. You see a lot more, especially in the AAPI communities, I'm sure in others, an increase in distress and discomfort that's often tied to mental health, if not always, but focusing on physiological complaints first, and that's where maybe we're seeing some of our referrals take place. Okay. All right. So, I'm bombarding you all with information, but I think we're making good time. So, for questions in the end. So here are some things that I want us to consider. Okay, now we've already established the multidimensional approach here. This is setting us up to be able to have those questions about identity and existentialism. But you can see how each of them, just because we want to have conversations about who I am and the meaning of life, well, we can't do that without also integrating our domains, right? The cognitive, the emotional, and the physical. And so one thing that I want us to consider, and for those who are trauma informed, this might look familiar, is that I want you to begin to be thinking about existentialism as a build-up, sort of, this is what we're trying to get to, but we can't get to it until we're able to understand, sort of untangle, if you will, where all of the distress is coming from. A more tangible example of this is how I have liked to normalize some of the existential dread for my clients that more often than not, we as humans don't preoccupy ourselves with our mortality or thoughts about death, unless you have an occupational hazard like therapists or maybe even first responders or people who often come across sort of confronting their morality in different ways. It's not a very common thought, right? If you have suicidal thoughts, perhaps. But that being said, COVID, sort of in the threat of COVID, is no different than the uncertainty that we experience when we're driving to work and not knowing whether or not there might be an accident, right? And yet, because COVID is so all-encompassing everywhere, if you will, on the news, it's what our friends talk about. I think I've had one client say, this is sort of the new small talk for dating online, so there are things about sort of COVID that constantly remind us of our mortality. But it is really no different if we normalize it a little bit than anything else that we may or may not have come in contact with the uncertainty of life. And so for some people that really decompresses. For other people, it's like, oh my gosh, I have all these other things to worry about. But regardless, it's not necessarily COVID in of itself that has that power. And so it's important to remember that some of these anxieties are coming from other places and they're just getting exacerbated because of COVID, because of that existential threat of COVID. And so here are some probes. Some of you may have already been reading it while I was talking, but worth highlighting again. So do these feelings in your body remind you of anything? So now we're looking toward the past or maybe the recent past. So it doesn't have to be all the way to childhood. It could even just be last week or 2 weeks ago, that you're getting a sense of where else anxiety or distress manifests in the body. This is important because it begins to decouple the power of COVID, if we're talking from a narrative or perspective, and perhaps we're deconstructing sort of the power of COVID as its own sort of separate external entity. And we're saying, well, you know what? You actually may have experienced anxiety like this before, and it's a good reflective point. So where else or what else does this remind you of? Sometimes clients are really good at saying, well, you know what? I had this moment in my life where I experienced this other type of threat. That feels very familiar. This is where those folks who are interested in doing sort of mind-body work can begin to, again, insert that breathing, insert that movement, or visual guided imagery. Describe that memory or experience. So now we're going to slow down a little bit and very mindfully and intentionally open up another space. So it shifts the focus away from COVID as an existential threat, something very ambiguous, right? And it begins to narrow it down and target on a thing or an experience or memory that clients have already gone through before. So it begins to sort of take away some of this fear of uncertainty, and it becomes more tangible for the client to be able to talk through, hold, and be able to say, okay, I actually have gone through this before and it was temporary, or I can do something differently. Okay, so now we're seeing that oh, now that I am able to shift that away from COVID in of itself as this big bad thing, ominous thing, there are things out there that I have experienced. Here's that sensory piece again, as we light up, as I like to say, the body with a client. We want to move them away solely from that cognitive space and be able to give light to what else might be happening for them. So as they recall an experience or memory, the client might be reactivated or re-traumatized in some way by it. But hopefully through doing this, would never, by the way, I never, by the way, would do this if I were just meeting a client. This is something that you begin to do and incorporate when you have worked with them for a while and have a good sense of their tolerance, okay? That being said, so you begin to sort of reactivate that with a client, and you begin to do a body scan. So now that all the senses are lit up, the client might actually be feeling that anxiety and distress. They've now tapped into it. And now we pinpoint where, remember, whether it's the stomach, the chest, the throat, right? And so now we're being able to target the breath a little bit more. So now we're calming down the nervous system as we're able to talk through these things, okay? And so we want to check in throughout. Of course, use your discretion and how often or how comfortable you feel. My Gestalt people will really like this. But how does it feel to share this with me, right, in the moment? My person-centered people too. So this also not only strengthens, if done correctly in the right timing and tone, this can strengthen the relationship. It can be a grounding factor for the client. It's feelings oriented, and it's a check-in for any type of resistance or transference for my psychodynamic folks. And so what image describes the distress or the experience the most? And so now we're creating visuals. Okay, so now we've talked about a memory. We've narrowed it down now to the physical and emotional experience. Now we're focusing on an image, right? So those my EMDR folks and trauma-informed folks might be doing something like this already. And then we want to recall certain thoughts. Okay, now we're going back to cognitive, right? Now we're interweaving all of them. Now we have both hemispheres of the brain lighting up. And now we're saying, okay, now we've calmed ourselves through this. Share with me what is, I like to say to my clients, what's left of that experience? So what emotional experiences or thoughts are still remaining from having that distressive moment from that time that reminds you of these times now that you're in COVID, okay? Because it's all connected, as we know as therapists. The other factor is, I get into this a little bit more, this isn't the last of this, but I just want to say, back to the tolerance level, we cannot do this without understanding if the client has a larger window of tolerance to withstand and sit in discomforting emotions, right? We may have to do more cognitive interventions, processing before we can get into something like this, because you're reactivating certain memories and triggers. Culturally too, when you begin to open up certain distressful feelings, to talk about loneliness, death, isolation, there are going to be a lot of experiences, perhaps from your client's past intergenerational trauma, abuse and neglect, that may be secondarily or indirectly experienced by our clients. And we want to make sure that we have that information and process that prior to doing something like this. And then finally, identifying daily triggers before this happens, like that's why purposefully we've talked about sort of monitoring any disturbances. We want to create boundaries of those things before we get into this too. You never want to get into this, I think it's common sense, but you never want to light up any of these emotions if this person is not in a safe place, if they have a hard time managing or regulating their emotions to begin with, right, that tolerance level, or they can't express themselves fully where they are, and they have to come down from that, okay, it can be really dysregulating. So hopefully you've done all of that monitoring ahead of time to begin to do something like this, okay? All right, so I also want us to consider some of the themes that we might be seeing in relation to that cognitive distress. So there might be themes that are coming up and related to responsibility, defectiveness. So some of you guys might be already seeing this pre-COVID, and it amplified during COVID, which is this idea of what does this say about me, right? Those of you who do REBT or DBT or CBT might do something very similar, where you have sort of that thought spiral, that technique in which you pinpoint a certain fear and you lean into it, and then you say, okay, well, if that were true, then what would that say about you? Right? It's a great little technique there. Okay, if all your friends, if you, let's see a changeable example that I've come across. If all your friends were socializing and you weren't invited, right? It's causing some anxiety, distress on the client. What does that say about you as a person? Well, it says that they don't like me. Well, if they don't like you, then what does that say, right? So some of you might already be doing that in your own work. That spiral is going to get you down to sort of the essence, or the bare bones of what the fear is saying for those narrative people. Safety and vulnerability, this one is spiking up a lot. I'm not safe in the space that I am, emotionally or physically. This is not an exhaustive list. My EMDR folks know these themes as well. And then power and control. When we think about choices, this goes back to those existential givens again, is this idea of I feel helpless in this position, both from a systems approach, if we think from a macro perspective, and then a micro one. I lost my job, right? Or I can't solve climate change, racial injustice. I can't create a vaccine. What am I even going to do? What am I doing with my life, right? And churns up a lot of those fears. Notice, though, going back to that re-trauma process, how these themes, these cognitive distresses, are actually going to come back up again because of COVID, but these aren't probably unusual or new because of COVID. So again, COVID didn't create these cognitions, but perhaps exacerbated some of them. These might be things that you've already worked on or highlighted with clients, but have to go back around again because you're noticing an increase in symptomology. And so you can pull from your previous work, or if the client's new to you, you can begin to talk through, well, okay, so once we've unpacked all of these things, what would you prefer, right? My solution-focused people, what would you prefer to think differently about yourself, for example? Have you thought about these or experienced this kind of hopefulness in other places? So if it's bringing up past experiences that were temporary, for example, how did the client come out of it before? So I can give you an exhaustive list perhaps of different approaches and styles as you've heard me throughout this presentation, but some of this will be nuanced to the type of approach you guys are carrying in and what kind of interventions you prefer. And then containment exercises. I'll be mindful of time here as we're doing good. So say we begin to rile all of this up in our clients, we begin to start making meaning and sense of it, and co-constructing a new meaning. Well, what are the opportunities from this? For example, my positive psych folks, we begin to create visuals, or that safe and calm place I mentioned, to get back into. Sometimes clients prefer to journal. My journaling folks, they keep all of it, and that's literally a nice tangible containment exercise, right? It's all in there. And I have clients who repeat the mantra, my worries will be here tomorrow. If I want to worry about it again, I'll worry about it tomorrow, right? And it gets them to go to sleep. But for other folks, a visualizing of a box, for example, for other people who are experiencing grief and who have lost people in their lives, whether it's physically or emotionally through a breakup, for example. They might do a letter exercise, my narrative folks, letters to the people that they've lost. So there's lots of examples of tangible, practical techniques you could do to complement some of these meanings, these cognitions. So I alluded to this already, but now we're at a place, right? We've sort of focused in on all of these domains throughout our sessions, the physical, the emotional, the cognitive, even maybe the spiritual, sort of the meta, right? And now we want to check in about looking for opportunity, right? Instilling that hope, as Yalan would say, would be one of our existential tenets there. But before I do, I just want to acknowledge I'm skipping over that first bullet point because we had mentioned that a little bit already. But going back to some reflection points and the second bullet. I don't know if anyone else is noticing this, but there's a lot of point of reflection here for most people. And again, I caveat this by saying some of this has to do with a lot of your clients intersecting privileges. For some folks, they don't have the ability or the I can't think of a better word other than privilege to be able to be thinking about this right now. Some people are moving locations when they're realizing their life isn't centered around work anymore, that there's some freedom, kind of going full circle back to our givens there, some freedom in not having a work-centric life, which our culture generally perpetuates. How do you create healthier boundaries and a routine? People are switching careers or exploring this opportunity. I'll skip over some, but we might see some exploring sexuality with partners, or even some endings of relationships that we can find opportunities in. And I already mentioned a few about how people are kind of checking in with how they can grow as individuals and enhance their life. I'm noticing an uptick in people coming to mental health therapy because I think perhaps it's becoming not only further less destigmatized, but I think now it's more normalized to ask sort of how are things really going, and people are sort of giving themselves permission to be all in the same boat. So there are just a few examples there of what people could ask. So I think I've rounded out not too far from time, and I know I've overloaded you all with information, and that's a little bit about how we can begin to plant the seeds of our technical skills and existentialism and setting that framework. So that's all that I have for you. I went through that fairly quickly. Content that you could probably go over in a multi-day workshop, and with the information that you have, or maybe with your own experiences, I might open up for questions here. Let me see if I'm going to scroll too. I know that I can't see some of you all, but if you have your audio or even your Zoom chat, I can just scroll and see if there are any questions there.
Dr. Ban, we did have one question.
Yeah, of course.
Someone asked, would they be able to obtain a copy of your presentation from today?
Yeah, of course, no problem. Is there a place that I can send that to? Maybe I can reach out to Dr. Armstrong and have them disperse that or put it somewhere.
Yes.
Yeah.
If you want, you can email Dr. Armstrong, and
great.
She will send it to me, and we'll make sure that we can get it to everyone.
Oh, thank you. Sounds great. Okay. Okay. Yes, so you guys will have that information with some examples as well. Any other questions? And if not, maybe that's where we spend our time, is kind of marinating over that. Yeah. Thank you. Thank you, guys. Okay, I might give it one more second. If there are no questions, that's absolutely okay. I know this may be a different way to be thinking about therapy from a dimensional dimensional place. And if you guys are looking to incorporate more meaning making, you can see also the upfront work too that you have to do in order to get there, and checking in to see if attending to our clients both physical, emotional, and cognitive space. Yeah. All right. So I don't see any questions, but a lot of gratitude. Thank you guys so much. I'm really appreciative of your weekend. I personally know how valuable weekends are. It's a way in which we reconnect maybe with ourselves and other people in our lives. So thank you, thank you. And if that's all that we have, I'll make sure that we get that presentation over to Dr. Armstrong, and yeah, you guys can have it for yourself, okay?
Well, Dr. Ban, we thank you so much for this presentation. It was great. And all the attendees, we thank you as well for attending. We appreciate you guys' cooperation. And I am actually posting a link in the chat. That is the survey that you guys will need to complete.
Thank you.
Once this is over, it should also send to your emails that you register with, but just in case, I've already pasted it in the chat, so you guys be sure to complete that, and we will distribute CEUs whenever we can.
Thank you all. Thank you. All right. Have a great weekend.
You guys have a great weekend.